My name is Sarah Clayton. I'm a mum of 4. I've 2 boys and 2 girls. My oldest, Abby, is 11. I've then got Tom, who's 9, Ted, who's 4, and Nell, who's the youngest at 11 months. I work for a community interest company and I work with children and adults who have very complex disability. So I do lots of direct family support, I work with family leadership groups, and I also work with health and social care practitioners looking at ways of supporting families really well. Postural care is defined as protection of body shape. People who find it difficult to move, whether it's because of a long-term health condition, whether it's for a short period of time, say if they've had a stroke or as a result of trauma. If you find it difficult to move independently, then there is a risk that you fall into destructive postures, particularly when you're in bed. And because you can't get yourself out of those positions, it causes predictable changes in body shape. And if people around the person understand what's happening to the person's body and how to put in really simple, cheap, effective ways of protecting the person's body shape, then you're able to avoid some of the secondary complications that are associated with changes in body shape. The people who are most at risk of body shape distortion are people with very complex healthcare needs who are completely dependent on other people for changes of position. And what we know is that a child will spend, on average, 3 times longer in bed in the course of the year than they do in school. And if we don't put any resources into that time, if we don't support mum and dad to understand what are the risks, how do we alleviate those risks, then we haven't got hope really of preventing those changes by doing things to people during the day. So that's what it's all about. It's all about empowering that very first circle of support. And with adults, it's PA teams, personal assistant teams, making sure that they are both confident and competent to provide safe nighttime positioning in particular. Not forgetting that people then have that time during the day where they're up and about, so specialist seating, all those sorts of things would come into the sort of postural care idea. Ultimately though, it's how do you protect a person's body shape so that they can live as healthy and as fulfilled a life as possible. So the nurse's role in providing postural care is absolutely pivotal. It used to be that postural care was seen as the domain of physio and OT, which is great because there's a huge amount of knowledge, of experience, of not only of different types of equipment, but also supporting different ways of supporting families. So that's all good, but if you look at the numbers of people that are involved, there simply aren't enough physios and OTs for this to really embed itself in care. And a really good example to look at is pressure care and the way that that's changed over the past 30 years. So pressure care used to be the task of the physio, and that has changed over time. The people who are able to offer advice and support have become very diverse. So it might be community nurses, it could be nurses in wards, it could be your GP. There's all sorts of different people that could be involved. And that really needs to happen with regards to postural care. Nurses need to be aware of when people might need to have extra support in the lying position. So for children who are growing, then it's absolutely essential that they're protected as they grow, particularly around growth spurt time. So puberty can be a really devastating time. And it's not unusual to talk to families who'll say everything was fine until he was 12 or until he was 14, and then it all went, horribly wrong. So we need to concentrate resources, advice, support, make sure the equipment systems are in place, all that sort of thing around that. But then there's a whole group of people that haven't really benefited from the advances that have been made in postural care. And those are individuals, so people with dementia, people who have had strokes, people who have had, up until a certain point in their life, no problems with regards to mobility. But then as they lose their mobility, we need to start then thinking about their postural care needs. So anyone who finds it difficult to move, no matter what their age, no matter the reason for them finding it difficult to move, we all change shape in exactly the same ways as a response to gravity if we can't adopt different positions ourselves at night. Postural Care Community Interest Company have worked since 2004 supporting people with accredited courses in postural care. I was working in the late 1990s with a group of families in Mansfield, and we were thinking through the types of support that worked well for families. And one of the things that came about from that study was that families weren't getting access to kind of really robust, accurate information, and there weren't necessarily systems in place. People say they deliver training, but then if that training isn't accredited or it isn't recognised or quality assured, then that really does bring about safeguarding issues, because what does the training consist of? Are people getting the right information at the right time? So we started working with the Open College Network in the West Midlands, who at the time were linked to Coventry University, and they're now independent. And we started looking at courses, developing courses for postgraduate students. And then as we were working with a development officer, she said, well, that doesn't really make much sense, because we have to come back to who's actually putting the person to bed at night. So we had a bit of a rethink and ended up with the courses that we offer now. So there's a focus really on family carers and personal assistants, looking at just very simple aspects of care, what people need to look for, how they need to go about providing postural care. But the whole emphasis really is on person-centred postural care. So we cover things like pain profiling. We look at development of postural care plans. So rather than, I think it's a movement away from the thou shalt use a sleep system for this many hours to, well, how long do you want to use a sleep system for? And because we use measurement of body symmetry, a method called the Goldsmith indices, it means that we know whether we're doing enough. So mums can stop beating themselves up because Paul won't sleep in the sleep system for this many hours, because she's got an outcome. She knows whether what she's doing is effective, whether she needs to do a bit more, whether they can sit back, relax and just get on with enjoying life. So Postural Care CIC is a tiny little organisation, but what that means is there's a great opportunity to do whatever we want, which helps us work with other tiny little organisations, and sometimes some quite big organisations as well. So one of our most important partnerships is with Partners in Policy Making, which is a family leadership organisation. They provide courses across the whole of the, I think it's mostly England, Wales and Scotland. I don't know about Ireland, but all about how health and social care systems work, the history of them, really helping people to understand how important it is that people are included within their community rather than sidelined because they have a disability. And I've done that since 2004, which was a huge benefit in my circumstance, because it meant that when Abby was poorly, my own daughter, I had a ready-made network of people that I could ask about education, about, all sorts of different things. And then larger organisations, we work with people like MenCap, and they helped us in 2010 to develop an awareness campaign. And a lot of people have found out about us through that campaign. So if you just Google MenCap and postural care, you'll find 6 lovely videos of people talking about their experiences of using postural care, and a booklet that people can take along to their GP if they're trying to find out more. One of the difficulties people face is that they might well find out about us, they might use the MenCap booklets and then find that services locally are quite tricky to access. It might take quite a long time, for example, to get the equipment in place and things like that, which is something that we're working very, very hard to help people understand, that isn't a cost-beneficial way of doing things. Because postural care is a preventative strategy, you have to get in there early, rather than when the horse has bolted and someone's already got a number of problems. So our courses are all accredited through the Open College Network. Our Level 2 course is approved by Ofqual and is on the qualification credit framework, and that's huge for us, because one of the things that we're very passionate about is that personal assistants, people that are providing day-to-day hands-on care, are recognised for usually the fabulous job that they do. It's not a very well paid job, and yet, you know, if we value people who have disabilities or who need support, then we have to value the people that provide that support. So providing qualifications that help them to have their skills recognised is something that we're really passionate about. Families like the fact that they're accredited courses as well. Some families come to us and they want one-to-one support. That's absolutely fine. Sometimes relationships have broken down between the service and the family. So we do quite a bit of mediation type work, helping services to understand why the family want a particular way of doing things, particular equipment or a particular strategy. And that usually is successful. And then the other thing that we do is help sort of get postural care into government documents so that people who are providing services are able to turn to a document and say, well, this is why we want to develop it locally, because the best practice guidance around health action planning, for example, says that you should, because the Royal College of GPs, within their step-by-step guide, says that the GP should check about a person's body shape. And it sounds small, but there's a huge amount of work that goes into getting something that's relatively unknown into important documents. So, and we have, again, another partner, Janet Cobb at the UK Health and Learning Disability Network, to thank for her support in terms of getting that into those sorts of documents, because without her, I think we would be too tiny, we would be too easy to ignore without the help of some. It's like having big brothers, people that help you get your message out there. The other thing that I would say is that when we think about primary care, we're taught about primary care, you know, where is primary care? It's GP surgeries or it's A&E or these sorts of things. And we talk about, I read a document recently that was talking about the front line, you know, of healthcare and that sort of thing. And people forget that the front line isn't at the GP surgery. The front line is in somebody's front room. And unless you change things in the person's home, whether they live within a residential home or within their own home, you won't change healthcare. The front line and primary care is before somebody steps out their front door. That's where you have to focus so much of your work. And we forget that a bit. Some areas do it really, really well. Looking at support of people with diabetes, for example, fabulous examples of how people are supported to self-manage. Other areas, like postural care, we're still battling on, but we will carry on battling on until people kind of recognise it for the fabulous sort of intervention that it is.